arrives 15 to 30 minutes early to prepare the operatory, washes hands at the beginning of the day. Presents an appropriate PPE to include gown, utility gloves, protective eyewear/face shield, scrub cap, and mask while using all chemicals. Flushes air-water line for 30 seconds at the beginning of the day and 30 seconds between patients. Do not put the air-water syringe tip in the syringe while flushing. To turn the unit on, we are going to slide this in the direction of the arrow. We are going to flush both air-water syringes. You will also flush each of the hoses that are located on the bracket tray by stepping on the rheostat. You need to make sure that the switch is flipped towards the blue side with that little dot, so water will exit the tips. We are going to flush the Cavitron and piezo tips as well. Checks intermediate level disinfectant wipes container for expiration date prior to use of product. Open new container if appropriate. Note that there's an expiration date on the top and a manufacturing date on the bottom. Utilizes the required intermediate level disinfectant product to clean all clinical contact surfaces and housekeeping surfaces. The purpose of cleaning the surfaces is to remove any dust or debris, any aerosols that have settled on the unit since the previous wipe from the day before. Clinical contact surfaces include the bracket tray, the air-water syringe, any of these hoses, the suction, the light handles. When she's wiping these hoses, she is going to wipe from bottom towards the end of the hose to help prevent breakdown of the hose. We are also going to shift that piece down because bacteria can settle there. Any of your housekeeping surfaces are surfaces that do not come in contact with hands during treatment. Those are going to include your floors, the trim, the outside. If these are touched with gloved hands, they need to be wiped and barriered. If students utilize the flags without gloved hands, then no barriers are required. Use second wipe to disinfect all clinical contact and housekeeping surfaces. Allows surface to remain moist for 1 minute. Follow the manufacturer's recommended time. The wipes that we have currently are 1 minute to disinfect all surfaces. This is the second wipe down. We get a complete second wipe and we touch all of the surfaces that we did prior. Goes to the sink, washes utility gloves with soap twice, then removes gloves, places gloves in storage area behind cubicle. Then she is going to wash her hands once. We are going to place barriers with clean, bare hands. When doing the air-water syringe, you are going to press the outer ring, place the air-water syringe tip in, let go, pull back, it should click. Then you can place the plastic sleeve over top. Do not place the plastic sleeve on first, as that will get plastic in the line and start to clog your tip. Same thing with the suction. We are going to place the saliva ejector in first, as far as that can go. It's easiest if you bend it a little bit. Then you are going to put your plastic barrier over top. There should be a little slit in the top of the bags where you can feed that through. Then we're going to cover the rest of that up. Place back in its slot. Over here, we have a bag for the chair. We have a large bag for the bracket tray. Note that if you're not using any of these hoses, keep them tucked underneath of the bag. If you're going to use them, you will pull them out, place them on top of the bag, and then you will place another barrier over top of that. We have our tray and our bib cover over our instruments. Over here, we have our chair, our operator's stool, with a piece of plastic tape on the back. Then all of the paddles that you may be using are going to be covered as well. A lot of students like to have the saran wrap over their little rolly drawer or rolly cart. Over at the computer, we're going to put a piece of plastic wrap over the keyboard, a piece of tape on the mouse, and a piece of tape on the polishing handpiece. Disposes of gloves that are torn, cut, punctured, or heavily soiled. Changes gloves and masks hourly during treatment procedures lasting longer than 1 hour. Removes patient bib and chain at the end of the appointment. Places on top of the instruments on the bracket tray. Instructs the patient to remove protective eyewear and places on the counter. In this instance, the patient has wore her own eyewear that she preferred to wear. Student will remove PPE, wash hands, and then dismiss the patient. Collects instruments in cassette and closes securely. Places cassette and or loose instruments on tray with tray cover to transport to dispensary for instrument management. So cassette is here. We have trays. The tray cover will go on top. The ends will slide to lock the cover into place for easy transport. Disposes of sharps in a sharps container. Disposes of biohazard waste in a biohazard container. Disposes contaminated barriers by inverting contaminated side and places in large plastic inverted chair bag. So we'll invert the chair bag. Then we are going to start to take down all of the barriers, inverting them and placing them inside of the chair bag. Don't forget to open up your trash container, remove the trash bag, and also put that into the inverted chair bag. Deflate chair bag. We are going to tie it together and place in a large trash receptacle. After throwing away the garbage, you will wash your utility gloves twice with soap and water. Utilizes the required intermediate level disinfectant product to clean all clinical contact and housekeeping surfaces. We are going to do another cleaning wipe. After the cleaning wipe of all clinical contact and housekeeping surfaces, we will grab a second wipe and disinfect all of the clinical contact and housekeeping surfaces again. We need to allow the surface to remain moist for 1 minute after the second wipe. Runs evacuation cleaner in suction lines. So you'll turn on your suction hoses and attach them to the appropriate slot in the suction cleaner. And we will use an appropriate amount of fluid. The final step, we are going to place the unit in the end of day position. We are going to center the bracket tray and the light over the chair, raise the chair all the way up that it can go. Any foot pedals that are here, we are going to place on the box down below. We are going to turn the unit off by sliding the switch. Might have already. And over here, the cabinets are going to be placed back where they belong. New garbage bag into the garbage can, which will go back into the drawer.